Good morning. This is in continuation of the NEET PG August 24 recall. There was a question on VAC, that is your vacuum assisted wound care device, and what was the ideal pressure setting. There were a few numericals given there. Let me give you a small introduction and the basic principles, and then I will take you into the right answer. So, a little bit about the basics of VAC. You have a wound here, and then you have a pressure device giving a negative pressure there. This is the machine which is giving the negative pressure. Now you need a sort of very good dressing so that the negative pressure is not wasted outside the wound. That's all, simple. So the dressing foam is put to form a perfect seal. So it's a method of decreasing air pressure around a wound to assist healing. It is also known as a negative pressure wound therapy. So next year you might get this question not as VAC but negative pressure wound therapy. And you must understand this modality is for difficult wounds, not for every wound. Please keep this in mind. It is only for difficult wounds. So let's have a look. There is a wound, there is a breach. And when you apply negative pressure here, what happens? The wound will automatically contract. This is the first step in wound healing, wound contraction. So if your wound contraction cannot be unlimited naturally, physiology will not give that privilege. So if your wound is very large, how much ever it contracts, still there will be a gap, and your negative pressure will help to collapse and bring about the contraction faster. Number two, invariably there will be edema fluid here that will not allow the cells to do their job, because the pressure outside the cell is more than the interstitial pressure. So this negative suction will remove that edema fluid. Number two, this negative pressure itself will deform the cells which are at the edge of the wound, and the deformation will release cytokines. The cytokines, most of them are beneficial cytokines which are helping in wound healing. They will lead to neogenesis, more vasculature, more oxygen, better efficient cell physiology. Not only that, the negative pressure will remove the pathogens also. So these are the various physiological principles behind applying wound pressure. And how much do you give? You give a negative pressure, not a positive pressure. The very fact it is vacuum assisted, you know the 120 is negative pressure, and you will do it. It is there for 24 hours, but it is there for 5 minutes, and a 2-minute off time is there. That part you must know, because you might get the same question but some other details of VAC. Now controversy will exist regarding the optimal application of negative pressure. So it can go from 50 millimeters to 150. But as undergraduates, you need not break your head over controversies. The standard is 120 mm of mercury, and it is minus 120. So you might get a question where it will be plus and minus 120. Be careful. Now, if you are really going deeper into the subject, as I told you, the range is from 150 to 125. Which are the wounds which need 125? They are the acute wounds. Which are the ones which need lower negative pressure? They are the chronic wounds. Keep this in mind, but by and large, definitely remember this. If your MCQ is going to be a little more difficult level, they might go here. So now, by the end of it, an intermittent negative pressure is much better than a continuous negative pressure. It is twice better than a continuous negative pressure. We'll come to it later. You will understand why. So this is your negative pressure. You put a foam and connected it to the machine. This is actually for a traumatic ulcer. He also has bone injury, so you have external fixators there. but you're dressing for the raw areas here. It's connected to the machine which is generating, and it is calibrated or put at 120 millimeters of negative pressure. It is indicated to give 120 millimeters of negative pressure. You can't see it, the machine is not very clear, but it is set at 120 millimeters. Now, it is a good alternative or even an adjunct to standard wound care. It has started becoming the standard of wound care in difficult wounds. It reduces the extent of reconstructive procedure. Suppose there is a large wound. By doing negative suction, by doing negative pressure therapy, you can make the wound smaller. So naturally, your reconstruction will also be less extensive. The optimum pressure, I told you, it is 120 by 120. Intermittent is better, that also you know. Now we are getting into some details of VAC. Definitely it is more profitable, more noteworthy than traditional wound care methods. Now, all the time people were talking about the cost. Cost is expensive, but there are custom-made devices which become much cheaper. So if they are going to ask you about cost, then yes, it is more expensive than your traditional saline dressings or your other antibiotic or antiseptic dressings, but definitely there are custom made methods of using this VAC, and the cost can come down very well. So your question was the pressure in a vacuum assisted closure. The ideal pressure in a vacuum assisted closure was all this, and by now you know the answer. The answer is 120 milligram. 120 mm. Okay. Okay. Now I just put up a little more deeper exercise with this particular takeoff point of a VAC dressing. I put different scenarios and asked where VAC will be of maximum benefit. These are the slides which you would have seen in various presentations of mine. And I've not brought in any new image. They are all from my personal collection, but you've already seen them in one presentation or the other. So let's have a look at the hemimandiblectomy. Look at the hemimandiblectomy. This photo is from Dr. Himanshu Soni. He is a very famous head and neck surgeon from Rajasthan. So this is a C alveolus. You have removed the alveolus, you removed the bone and everything, and there is a huge wound gap. Now, can you apply a VAC dressing here? No, because this is more than skin and soft tissue. The defect is more than skin and soft tissue. You need a composite graft, a graft which will have the mucosa, the skin, the muscle and the bone. So this will require a composite graft. What about the scrotal wound? Very small wound. You can allow it to even heal by secondary intention. So not in this situation. Look at the bed sore. Huge. Very difficult wound. This is not going to heal by secondary intention at all. Neither is there an indication to take a composite graft there because there is no bone loss. These are the ones ideal for a VAC. So this should be your answer. The ideal will be this image. Let's look at a large thoracic wound. See, huge wound. You may be thinking, maybe this will need a very sophisticated wound device. No. One, even if there is tissue loss, this patient, you cannot apply a VAC because it is over a cavity. You will not be allowing the lung to expand if you are putting negative pressure there. So you must either think of some other cover like a flap, or in this case we were lucky, he had only a large horrendous wound which was really upsetting visually. but there was no skin loss. It could be closed primarily itself. So these are I brought in all these ulcers, which were already, this came in oral cancer, this came in ulcers, this again came in ulcers, and this probably came in wounds. So you have seen all these in one presentation or the other of mine, and they are also coming to tell you which ulcer or which wound out of these is best suited for a VAC. So this is best suited for a VAC, and I also told you why these are not best suited for a VAC. So thank you very much. Even though it was a plain recall question this time on VAC, the way the exam is going, they are trying to get into the concepts. So next year you're likely to get a VAC, but the questions are likely to be deeper and more concepts you need to have in mind. That is why I decided to take and also give the 4 types of ulcers and which one of them is ideal for VAC. Again, thank you very much. I'll be coming back again with another NEET recall. Each time I'll be doing only one recall at a time. So you can expect about 20 to 25 recalls almost daily, because I think 25 was the number of questions in surgery. I will also be handling recalls of preclinical and paraclinical, which have got a lot of surgical flavor. Thank you very much. Please do subscribe, share and like, and also there is my Telegram